So, good morning, good afternoon, whatever it might be, wherever you might be around the country at this moment in time. My name's Pete Doyle, and I'm the head of health and safety at Citation. And I'd just like to invite you all to a small session that I've got planned for today to deal with some of the health and safety concerns that organisations have got as they are returning to whatever the new normal is going to be in the workplace. So with that in mind, I've put together a small session here today. Please feel free to drop me a note if you've got specific questions. I've already had a number of questions put to me by people who've expressed an interest in joining the session today. So all I'd say is that hopefully I'm going to go through most of the points that people want covering. But if not, please don't hesitate to put a question in the bottom right hand corner or wherever it is on your screen so that I can actually see it. Please bear with me because as you can probably imagine, I'm socially distancing, so I'm working from home. So what I'm trying to do is manage all of this on my own, but I do have other people supporting me in the background. So I suppose a little bit about who I am first and foremost. As I say, my name's Pete Doyle. I'm the head of the health and safety team at Citation. I currently manage a team of 80 safety practitioners who are based throughout the UK. And we are an organisation that predominantly help small to medium enterprises deal with their day-to-day health and safety inquiries and activities, and help them make sure that they stay the right side of the legislation. What we try and do wherever physically possible is give people practical support and advise them on how best they need to change their working practices in order to satisfy the requirements of the Health and Safety at Work Act. So I'm going to try and answer lots of questions for you today. One point I should make out is that I am a health and safety practitioner. I've got quite a bit of experience under my belt working in various industries. But what I am not a medical practitioner. So I will not be able to support you with regards to clinical governance and so on and so forth. However, what I will be able to do is hopefully give you some steers as to who's the best authority to speak to on those clinical matters. And more importantly, to give you guidance from a safety perspective of the things that you should be looking into and considering. So with that, the anticipation is that this session will last for an hour. If it's slightly longer, then so be it, but it's intended to be an hour, and all of this will be available to everybody as and when the session is finished through Facebook. So I think the first things that I want to cover are with regards to organisations getting back to a period of production again. I mean, from the middle of March, this country's faced something that we've never faced previously, which is a virtual shutdown of all non-essential activities, for whether that be in the leisure industry, or whether that be engineering, particularly for engineering where they're reliant on other people providing them with products and so on and so forth. Day nurseries, not so much in the care industry, but sometimes there've been some impacts with regards to care. But typical everyday activities, hairdressers and various other organisations have had to face something we've never faced previously. Now, I'm pleased to say, I'm recording this on the 29th of April, that we're starting to see the signs of organisations now being encouraged to go back to work, so long as they can do so safely. I will point out that the guidance from the government at this time is still that if it's all physically possible and you can undertake your activities without going out, that's what you should continue to do. However, we are all being encouraged to consider carefully how we can get people back into the workplace and do so in a safe manner. And the phrase that's being referred to most often there is social distancing. So for those who are in the construction industry has already started to ramp back up to make sure that they're able to get back to building properties, maintaining services and so on and so forth, so that they're able to undertake day-to-day activity. The difficulty there is obviously the supply chain. So that's where lots of other organisations will be asked to support them by getting back to work in a safe manner. So what does social distancing mean? In essence, it's talking about how organisations where people have got to be in the workplace are able to maintain a safe working practice. And this is something that we've not been used to previously. However, guidance from government is coming out that is suggesting that social distancing is likely to be with us for a considerable period of time. So it's something that we need to get as safety practitioners and as businesses and organisations, we need to get into our everyday working practices, how people and businesses can operate safely and use social distancing. I mean, I've had a number of questions coming in with regards to social distancing. So what I'm going to try and do is roll them all into one type of answer and give you a step-by-step process. I mean, let's remember, in the first instance, people should not be returning to work if they are exhibiting signs of COVID-19 or believe that they've been exposed to somebody that's got COVID-19. So when we're talking about people returning to work, obviously they need to be fit and not posing a threat or a risk to other members of the workforce. So you need to have in place clear guidance for your staff and your team that if they believe that they are still in the throes of suffering with COVID-19 or have been exposed to it, that there needs to be a process in place to ensure that they do not bring in any viruses to other individuals who may not have already been exposed to it. You know, so simply put there, you know, it's making sure that people are safe to enter the workplace. You will also have potentially some of your staff who need to be shielded. So again, not from a health and safety perspective, but more from a socially acceptable stance. People need to consider individuals when they want to return to work, that whether or not they have underlying issues that would ordinarily mean that they should be shielded. So I would suggest that you need to take guidance, you know, using citation as an example, take guidance from our employment law team and our HR advisors to say, well, what was the safe means of actually saying and identifying who should be returning to work. So there needs to be some sort of process in place. And for those of you who have been through the furlough process currently, there's obviously a means of bringing people out of furlough. So again, please take the relevant advice to make sure that you are bringing people out so that you are making the most appropriate use of the resources available to you. One of the things with regard to social distancing has obviously been this piece about the 6 foot. How do you keep 6 feet apart in certain industries? Now, you know, most organisations will go, well, that's physically impossible. Well, the instructions and the guidance we're getting is very, very clear that you have got to consider how you can do that. Now, if you can't, then you need to undertake further examination of the work process, and that's by doing a risk assessment. And I'll come on to risk assessments in a little more detail later. But the truth of the matter is that you need to, where physically possible, consider these things. So in the first instance, you know, let's look at your workplace. Is it safe to bring people back into the workplace? So have a look at that the building facilities are actually safe, that there's been no exposure to gases, no leaks or anything that make the building dangerous in the first instance. Then plan how you bring people back into the workplace. Have a look at your organizational structure, what your workstation's like. You know, are you able to naturally space people so that they are at least 6 foot apart? If so, that starts to help you build an assessment into how people are going to deliver a service for you and help turn the cogs back into perpetual motion so that things start returning to whatever the new normal is going to be. The fact of the matter is that in an office environment, it may be that you have to leave spaces where normally you wouldn't have spaces. You'd have people along a bank of desks, so you need to consider that. And you know, often simple means of indicating that this is an area that people should not be sitting. You know, simple no entry sign or something like that on the desk, so that people clearly know that's an area that they shouldn't be in. The other suggestion I would give is physically remove chairs, so that if there's nothing there for people to sit down on, then they're less likely to enter that area. Use simple signage, indicator signs, you know, information. Please bear in mind, remember that you can socially distance. For anybody who's been to any of the major retailers in the last few weeks, you will have seen that they've started introducing this as a matter of practice in the thoroughfare and the flow routes to and from various aisles within shops. So it may be, I'm not saying that you need to plaster your floors with all sorts of signage, but consider how you would make it aware and make people aware so that it's at the forefront of their thought processes that they do keep their distance wherever possible. One other thing that with regards to the social distancing and the whole element of that is that we do need to change our hygiene practices. You know, whenever people enter and move around in buildings, they will be touching various door furniture, other items of equipment, and so on and so forth. And one of the things that is becoming very clear that one of the most effective means of stopping cross-contamination and people handling the virus onto other people is by good hygiene practices. So we will start to see, and I would expect people to start putting in place that they have suitable hand washing or hand cleansing facilities around their premises. Now, in lots of organisations, that's simply done through the welfare facilities that you've already got with regards to toilets and so on and so forth. But in others, it may not be so simple. So all I suggest is that you use things such as, you know, hand wash, alcohol hand wash around workstations so that people, as they're coming back in, regularly cleaning their hands and making sure that they've effectively cleaned themselves before then moving on to the next workstation. Also, the hygiene practices and cleaning around door handles. Remembering how many people may come in and out of your premise or of a certain part of your premises may lead to cross-contamination on that people are touching that point, and you'd be astonished at how many times doors open in a day. So it may be that you may need to consider other means of either cleaning or having a temporary measure in place where the door is not forced open, but the door is held open, and should there be any fire alarm or anything like that go off, that the door then automatically closes. But that may take a little bit of engineering and other consideration for you to actually put into place. Especially, you need to be aware of what the fire precautions are within your building as well. One of the things that I have been asked is with regards to visitors, and please forgive me, I don't see the names on who's asked me these questions, but one of the questions with regards to, you know, can I still get people into my business to undertake servicing? The truthful answer is yes, because more often than not, you've got to have a safe environment to work in. So, you know, recognizing that there are certain legal and statutory checks that you should be undertaking in any business, that you may need to bring other people in who have those competencies because you may not have them in your workforce. You know, the perfect example of that would be a fire alarm engineer, it could be gentleman or the company that's servicing your lifts and so on and so forth. They have that expertise, you necessarily don't. I'm going to cover fire and statutory in a little bit more detail, but you need to ask them, what are their precautions? What steps are they putting in place to ensure that their staff are remaining safe, and more importantly, that they're not introducing something to your organisation? So again, it's a bit of cooperation, and you know, the Health Etiquette Work Act demands that we all cooperate with each other. So people should be expecting to be asked, what are your risk assessments, what are your safe systems of work or method statements or whatever it is, of how you're going to undertake support for me. You need to advise people of what the risks are within a workplace. So make sure that people are aware of their surroundings and aware of what their impact is on other people. Because you may have people who say, I've had COVID-19, and the understanding, although it is being challenged at the moment, is that those who've had COVID-19 are then somehow immune to it. But there's more and more information coming out that that's not necessarily the case. But again, it's one of those things that people just need to be aware of and go, actually, just because you've had it doesn't mean that you can't then pass something on to everybody else. So you may need to initiate processes where people within your business keep an eye on what other people do, because they could inadvertently contravene some of the processes that you've put in place. So you need to be able to deal with that. And again, that comes back down to good HR practices and so on and so forth, so that there is a process in place so that people are not contravening what others are meant to be doing, so inadvertently or deliberately in some cases exposing people to risk. So you do need to consider that, so that you've got an element of control in place and be able to deal with it. Because there's nothing worse than having processes in place that nobody adheres to, because then you as the employer are then liable because you've condoned it. So what I'd suggest is have a monitoring process in place, do physical, you know, just viewings and just regular checks to make sure that people are adhering to it. A question that's just come in is should I put signage around the workforce to ensure social distancing? As I say, yes, I would just put simple notices around saying, please be aware we are trying where possible to keep 6 foot apart. Nice question here. Should communal areas and tea and coffee making facilities be closed? I would not condone closing them. What I would suggest is that people actually review what the facilities are. You know, there will be some offices that have got nice large premises where they can, you know, a group of people can go in and sit down and have tea and coffee. There'll be others where it is literally just a chair in a corner. So review your own circumstances. The simplest way again is by isolating areas, so that if you know you can't get the 6 foot clearance in an area, take chairs out, or you know, use hazard tape or something similar, so that people don't sit in those chairs, so that they don't congregate, and make sure that people are aware of it. One of the things you may need to do is review when you take your break times. You know, going right back to the very basics, you may need to review what your starting times are, so that you stagger people entering the building at certain times of the day or departing the building at certain times of the day. So again, all of this is part of the thought process that the people need to have in place to make sure. How I thought of this, and engage with the staff. I'd always strongly urge you to engage with the staff, so that you know and they know what is physically happening, so that there's no confusion, and that people tend to buy into things that they're involved with. So if you've engaged with them and say, right, how are we going to make this work better? And people will come up with ideas that you may not have considered, but it's perfectly workable. So, you know, bring those into everyday practices. Please forgive me, I'm just going through a question here with regards to face masks. Let me just find the question. Effectively, what they're saying is that, can I introduce face masks and gloves into the workplace so I can bring more people together? That is not in the spirit of the guidance. You know, the guidance is still out there that if at all possible, people should work from home. If that's not possible, then you need to find other means of putting people safely into a workplace. There will be circumstances where people have to come closer than that 6 foot distance that everybody's talking about. So in those circumstances, you do need to consider what other precautions you put in place. And that may be that you use personal protective equipment, such as masks, gloves, and so on and so forth. My only caution to you is that if you start determining that in a workplace that people should be wearing masks, then you need to make sure that they are suitable for the risk that they are facing. Most of the masks, we all see it on the news at the moment with regards to the NHS and the care sector, how difficult it is to get hold of masks. But again, it comes back down to the piece that the mask needs to be suitable for that task. So in an engineering workshop, for argument's sake, where people are manoeuvring pieces of equipment around to move them from one workstation to another so that they can carry on engineering and machining it, then it may be that you do need to introduce temporary measures that people are using masks because they're facing each other. I have seen some guidance from the construction industry that suggests that people face away from each other with regards to, so that they're not breathing across each other. Sometimes that's going to be far more difficult to manage than actually putting some of the precautions in place. So all I would say there is just to have awareness of making sure that whatever you're putting in place is practical and it's not going to cause other issues. So again, my steer to you with regards to that element is, yes, you can consider protective equipment, but in the hierarchy of control, it should always be towards the bottom end, if not the last thing that you consider. You should try and do things as far as possible by avoidance, rather than deliberately going ahead and doing this and then putting something in place to make sure that you've taken some controls. Because again, it comes back down to a risk assessment. You need to capture and say why you determined that was suitable in the first place. Question here: when can I start allowing individuals who are not employed to buy my company into my business? That, I think, is more down to the fact that I would urge you to consider whether visitors, and by that I mean casual visitors, salespeople and such like, dropping in unannounced to you, whereas, as I mentioned earlier, with regards to people who are coming in to carry out a service or provide you with a service that you don't already have, that you do that by arrangement, so that you make sure that you know that they're coming, that there's appointments made, and again that you understand that they know what your precautions are and what your working practices are, and it may be that you may need to isolate a part of the building that you wouldn't normally isolate for them to undertake that task. So again, it's a matter of communication between the two different parties and making sure that people are aware of what they can and can't do, and more importantly, what their actions and interactions are going to be with others, so that they're not bringing anything into your premises that will endanger anybody else. Oh, nice question here. It's not so much social distancing, but it is part and parcel of it. Will I be required to deep clean my workplace on a regular basis? My honest answer to that is I think that we will all need to review hygiene practices in workplaces. If you think that, especially if we go into the phrases desking, where different people are sharing the same desk at different times during the week, I think that we will definitely need to introduce and organise, consider introducing how you are going to make sure that that space that Pete Doyle was on today is safe for somebody else to use tomorrow. So I think that there may need to be a clean as you go process in place so that people are physically cleaning with commercial wipes, domestic wipes, or whatever it is, so that the surface is left clean and tidy. It may be that in conjunction with whoever provides your cleaning services or the individuals on that workstation, that they do it so that at the end of every shift it's clean, and that at the beginning of every shift that people make sure it's clean as well, so that what you're doing there is minimizing the opportunity for the spread of droplets and so on and so forth that can help spread this disease. Here's one that's, it's very relevant. Fridges and freezers and other welfare provisions, what should I do? Well, my first recommendation to you would be, obviously, before you reopen, but we all know from our past experience, whenever you've come back off a holiday and you've left stuff in the fridge at home for a period of weeks, that it tends to have a decay, even though it's been kept under refrigerated conditions. So I would strongly urge people to make sure that there's some means of the looking at having to make sure that surfaces are cleaned and kept in some sort of hygienic area prior to them going forward and starting to use the facilities again. So it's just to make sure that it's hygienic is more often than not. But I mean, yeah, it's a valid thing. Fridges and freezers people use for welfare. You definitely need to make sure. And remembering again, fridge door handles are the piece of equipment that's probably going to be touched most in an office. That one item where people are going to the kettle and plugging the kettle in if you've got a kettle or whatever your system of heating things up, those are the surfaces that people will forget about. So again, it's a matter of having a sensible precaution in place, whether that be hand wipes and so on and so forth, that people wipe down the fridge every time, or that something simple, and so that people actually get into the habit of making sure that they're doing things effectively by rote, that they're always going to do it. So other areas, travel arrangements, yeah, actually that's very valid. Lots of people car share. We've been encouraged for environmental reasons for a long period now to car share wherever possible. So when people are car sharing, they're going to be within that 6-foot distance. Now, if they cohabit or if they live in the same household, then that is not a major issue. However, in the typical work environment, it's very rare that you're going to have husband, wife, and partners traveling to the same organisation. So it may well be that people need to review what their travel arrangements are. And that has an impact on a workplace with regards to your car parking spaces and so on and so forth. Now, it may be that you're able to adjust your working practices in such a way that, we've become used to over the last period of weeks of people working from home. So if that's physically possible, continue with that. And therefore, the number of people that are coming in the office is reduced. However, if you're in a production unit or something like that, that's very difficult to do. And especially as we get back into trying to get back to full production, it may be something that you need to consider. Organisations who do deliveries and do installation, you may well have 2 individuals in a vehicle. Again, you've got to review that. I've been dealing with an electrical company recently, and they're normally 2-man installation teams that go out, and what they've determined to do is that it is safer now to send 2 guys in 2 separate vehicles. Yes, they'll work fairly close to each other with the relevant precautions once they're on the work work location. But to get there, they're choosing different means of transport. That's more difficult for organisations to travel large different distances. Again, look at review how people travel to work. There's lots of people started riding bikes and so on and so forth nowadays. So it may be that you need to provide other security for people to put their bikes and such like into place. So I think hopefully I've covered off a lot of the elements there with regards to social distancing. Apologies if I've not, but I want to move on to some of the other key areas and the key risks that there are in businesses when they reopen more or come out of hibernation, is the phrase that I keep using. I mean, the first element that I would always encourage everybody to do is make sure the building's safe. Make sure that whatever you are going to be using, it may be that you determine that you're not going to use the whole of your structure in the first instance. You bring parts of it back into production first. So the first thing is to make sure that it is safe to do so. Make sure that there's been no gas leaks, there's been no floods, there's been no other contamination in your premises. And part and parcel of that is to do with Legionella as well. You will find that organisations that have lots of water in their building, especially those who have showers for the staff and so on and so forth, that water will not have run for probably a period of 4 to 6 weeks now. So there needs to be a process in place to ensure that your water supply has been flushed through, and it may need cleaning. So it may be that you need to get professional advice on what is best suited for you. It could be that you've had somebody going into your building and running the water frequently during the period where you've been in hibernation. That's fine, but again, you do need to consider it, do need to be careful about it. With regards to engineering, I mean, one of the things in engineering is that organisations that produce swarf, and there will be a coolant material that you'll have ejecting onto the piece of metal. Again, that is a high risk area with regards to Legionella. So it's a matter of considering that. How can you dispose of that safely? Because if it's sat there for a period of time, there is, especially with the weather we've had recently, you've had the perfect growing condition for the Legionella bug to actually help itself grow and develop. So please consider Legionella as a risk. It wouldn't, in a lot of organisations, be a massive risk ordinarily, but because we've had a period of where you've been dormant, it may well present itself, especially when air conditioning units and water systems are first turned on for the first time. So it's a matter of making sure that people consider things like that. The other area would be with regards to having a look at what your statutory obligations are. And this would cover things such as, if you have lifts in your premises, just make sure that they are still within the date of their last lifting examination, their thorough examination. Now, it may be that you use shared facilities. So again, the point would be to make of your landlord to ask, can you please assure me that these checks have been continued, or if they've not, when are they going to take place? Because obviously there may be some organisations who've been unable to get out or into a premise, but it's a matter of making sure that people have this back on their radar to undertake those physical examinations. The other ones would be with regards to fixed wire examination, lifting and lifting equipment. Anything that carries a person should be inspected every 6 months. Anything that carries anything else, such as goods lifts, should be examined every 12 months. Not every 14 months. That's a slightly different one. That's to do with local exhaust ventilation or extraction ventilation, LEVs. They should be examined every 14 months. So again, it's a matter of ensuring whatever you're using in your workplace has had its thorough examination. And one that everybody in every working place will have is the electricity. So making sure that your fixed main wiring inspection is still in date. It may be that it's got years to run on it, but typically it's an item that myself and my team identify when we go around it, because it comes up less frequently. It's typically 3 or 5 years. The majority is 5 years. People seem to forget about it. So just review that. If you're going to bring yourself back into normal production, have a little check of when was the last time your fixed wiring was inspected, and have all of the actions that were identified on it been dealt with. Because it's all well and good having a fixed wire inspection, but if you've not actually closed out some of the non-compliances, then you're actually endangering or potentially endangering people. So please consider those. So with regards to those are some of the predominant statutory. There will be others with regards to statutory that step into fire. Part of and I'll deal with this as part of the strategy, but often when a building is not fully utilised, people switch everything off, obviously for energy conservation and so on and so forth. But you may inadvertently then switched off the power supply to your emergency lighting system. And the emergency lighting system is meant to discharge and then your lighting comes on. So whenever the power drops, your emergency lights come on. Now, it could well be that as you've done that, you've then drained the battery in all of your emergency lighting in your premises. You're not going to know that until you do a discharge test. So I would strongly urge people to review what their practices are with regards to their fire equipment and their fire appliances, because your alarm system should be examined every 6 months, should be inspected and tested every 6 months, purely because of the battery. The other side of that is that your emergency light testing, which should be done weekly within your system, but not every light within the system weekly, but that people are then verifying that every emergency light works within a cycle. So it may be that you need to do a major test or a major recommissioning, if you like, of your alarm system or your emergency lighting system or whatever it may be, to make sure that it is safe to use when you go back in. Because relying on the fact that it worked 6 or 7 weeks ago may be fine, but the chances of it having a failure and you not noticing have increased significantly because there's nobody been in your premises. So typically we would recommend a recommissioning of an alarm system or a recommissioning of your fire system as a whole. You know, so check your alarm panel, see if it's had any faults. If it has, call out whoever your engineers are that are supporting you and make sure that it's safe to go back into the premises. Because, you know, we've gone through all of this. The last thing we want is to have a risk that we didn't consider because, you know, a piece of equipment wasn't verified and checked. On the topic of fire, one of the things that I would strongly urge people to review is the fire risk assessment. I mean, you know, we all know that every building should have a fire risk assessment, no matter how complicated or simple a building is. There should be a fire risk assessment in place for that. But please consider that as you return to work, you may not be bringing everybody back into the workplace that you had previously. You know, that's the one thing that this whole COVID-19 experience is bringing to everybody's attention now, is that we can work smarter in some locations and some instances. So not everybody needs to be in the building at the same time. So just review your arrangements. You may not be reopening all of your property or all of your facilities. Therefore, some of the precautions that you have in place may not be applicable, because it could be that you've kept an area or a wing or a workshop closed, but that was the emergency escape route for people to get out of their building to make sure that they could escape in a safe manner. So review your fire risk assessment, make sure that it's practical and suitable. And, you know, one of the things that I've not covered yet is that how are you going to evacuate a building and adhere to social distancing? Because if you think about it, when you need to escape that building, typically most organisations, my own included, has one assembly point. So there could be, you know, we're in a block of 3 floors. So effectively there could be 300 people escaping that building to one assembly point. So that needs to be reviewed, because social distancing will be really, really difficult there. So you may need to have a look and say, do I need to have additional assembly points around my premises? And also consider what the impact is of you evacuating and other tenants in the same building evacuating. So there needs to be an element of communication there and discussion, and just say, right, how do I get to a situation where I can evacuate safely? You know, remembering that stairwells are very narrow. So is it that we encourage people to leave by different means, but you've still got to get out of the building safely? So you may need to take some advice and assistance there with regards to how people are going to escape your premises. Let's hope that you need to do the drills first and that you never need to do an actual evacuation. But we need to test the process, or I'd recommend that you test the process to see how it is going to work. As I say, often on reopening, people haven't checked the lighting and so on and so forth. So please put that into place so that there is a means of verifying that people have done what they need to do. Question here. My office is based in a building shared with other businesses. How do I ensure other businesses are taking precautions? this is cooperation, plainly and simply. I think that what we're seeing, or we will see as businesses start to reorganize themselves, is that there will be greater cooperation. There has to be, because people have suddenly realized what the impact of one organization is on another. So I would suggest that's a simple conversation with regards to other tenants in the building. If you're in a managed premise, I would do that through the managing agent or whoever is the organisation responsible for your building. But again, it helps to know what their controls are or what their recommendations are. So one, you're not contravening them, and two, that everybody else is then working to the similar set of standards. So you have an issue there that is, again, comes back to communication. Should employees who can work from home continue to do so? Yeah, that is an individual organisation's thought process, but the guidance as is at the moment is still for companies, where possible, if people don't need to go into an office, into a work environment to undertake their day-to-day duties, then that is what is being suggested and recommended, that where possible we minimise the interaction between people, so that there is always an opportunity for people to physically separate. So if you can do that by making sure that others are not coming into your premise, or you know your own staff are not coming in, then it's a matter of making sure that people are covering the duties that they need to. Question here: do we need to have health screening in place? My general guidance on this is that after there's been, you know, if you were introducing new staff to your workforce, you would do some form of health screening with an individual to say, right, do you have any pre-existing? And it's a straightforward, simple health screening questionnaire. I'm an advocate of that. This is an opportunity for us to restart the clock on lots of organisations, because I keep referring to it. The new normal is not what we used to do. You know, we're definitely seeing this now, that organisations probably work very successfully in a manner for a number of years. However, now in the current environment, people are not they're not used to what they used to do. They've had a period of weeks of not doing it anymore. So it may well be a good idea. And again, I liaise with my colleagues with regards to the HR and employment law side of it. It is a good idea to do frequent health screening, and I'm not talking about in-depth, you know, full medical questionnaires here, but simple health screening, so that you can identify that if somebody has, you know, in the intervening period had something that they've become aware of, whether that be diabetes or you know other unknown illnesses to you in the past, that you're then aware of them, because there may be, as I said earlier, with instances with regards to shielding that come out on the back of this. So my advice is that I would seriously consider doing some form of health screening, so that you actually make sure that you know what is within your workforce and environment. I mean, just on the topic of that, I would advocate almost doing an induction program again for everybody as they return to work, so that you as an employer are then aware of, everybody now knows what the new rules are. You know, it may be that everybody's got used to what they did in the past and only the new staff got an induction. I think this is a really good way of resetting the clock and realigning everybody's expectations of what will happen in the workplace. Here's what our rules are. Here's what we're going to do. We're going to introduce toolbox talks or whatever, you know, team briefing documents, whatever you'd like to call them, so that people are aware of what is required of them. Because I find that when you engage and bring the staff along with you, that it's often a far simpler process, rather than going in and making statements and saying, "Oh, we've got to do this," or the health and safety guys say you've got to do this. I think it's a good idea to actually just reinvigorate an organisation just by doing brand new inductions and saying, "Look, what's gone on in the past, we're going to start fresh," so that everybody knows what the ground rules are. Everybody knows what the safety precautions are. You should be doing it anyway with regards to fire, security and safety in the workplace. So let's roll it all into one. Let's make workplaces that little bit more focused, and it does help organizations, because then people start to do things in a safer manner. And sometimes you will get somebody come to you and say, do you know what, I think we should change this working practice, or we should change the other. So it's a matter of making sure that people recognise what their responsibilities are, and more importantly, how they can help contribute to making sure that everybody at workplace stays safe. Normally I have over 50 employees in a relatively small office. Could I ask more people to work from home and the other half to work for the office? Again, that comes back down to whatever you as an organisation believe is right and appropriate for you. My head says to me that yes, I would actively seek to minimise the number of people. It helps you with your social distancing issues, but it also sometimes you need to consider how you're going to communicate with everybody. Now, I'm on Facebook Live with you today. Lots of people are using various other platforms to do their day-to-day communication with people. So you're probably seeing more of people than you would ordinarily see of them in the office. But again, it's a matter of making things work. It's just being conscious of how you rotate with people as well. Some people may prefer the home working than working in the environment in the office. But again, it may be other things that people need to consider. Question here: do risk assessments need reviewed? Yeah, obviously. What I say, obviously, I'm a safety practitioner, so to me, risk assessments should be reviewed whenever there's been a change in circumstance or there's been an incident. Well, I think COVID-19 has been a massive incident, so that people need to review whatever their current risk assessments are and just make sure that they're fit for purpose. It may well be that they are, and there's absolutely no changes, but it could be that the person that did the routine examination or checks on the guards is no longer in the business. That they may be shielding, or that they may be on furlough, or whatever it may be. So it may be that an important element of your control has actually, for no other reason, is just not there. So nobody is doing it. So I think that I'd strongly urge people to take the opportunity to review risk assessments. And again, going back to the piece of engaging with the staff, get the guys the people that are actually working on that plant or equipment or that process to review them. And so actually that's what we do, or no, it's not what we do. So it's a simple process of making sure that people can say, yes, I know what's happening and I know what's not happening on that area. But with regards to any element of reorganisation that's gone on, so you may determine, as I said earlier, that fewer people are working at any one time. That may have implications on your risk assessment. So please consider that whatever it is that you've changed that is captured, because your safe process may have been that it was a 4-man lift or whatever to do a job, and there's not going to be 4 people in that workshop at that time to do it. So please have a look at what your processes are and make sure that you adapt and adopt to capture them. One important element to consider is, especially as people have been facing shortages of stock, shortages of equipment and chemicals, is that you may have substituted a product for something else. Often that has no detrimental effect, but on odd occasions, especially with regards to chemicals, it may well have an impact. You may have introduced or been substituted a product that is very, very similar to what you used to use. However, it is not exactly the same chemical component as it was, and there may be repercussions to that. So please review your control of substances hazardous to health, your COSH regulations and so on and so forth. They're still relevant and pertinent. All I suggest there is just get whoever your product supplier is to send you the new safety data sheet and just check if anything. You never know, something may be a contraindicator that you weren't expecting. So it's a matter of reviewing. Now, I know that people will have gone, oh, well, I've got to have something to do with this. It's always a matter of making sure that you are then, once supply chains have reinvigorated themselves, that you're using the most appropriate piece of kit to suit you at that time. And the truth of the matter is that who knows what's going to change in the coming future, but it may be supply chain difficulties come back in, maybe go out. So it's a matter of reviewing your COSH assessment and making sure that whatever it is you're using is actually captured. There is one important element with regards to COSH, and that is COVID-19 is a disease. So I think that everybody should have a form of review of what it is that they will do should they have an outbreak of COVID-19 or be made aware of an outbreak in their vicinity or their building or whatever it is, because you will need to have that as part of almost a business continuity plan to say, right, what are we going to do? What are the processes that we need to initiate? Will we need to do some form of health screening? Will we need to do some form of deep clean if somebody's been in the office or in the workshop that's had it? And so it's things like that. So on the grounds that COVID-19 is a horrible disease, and it's a matter of making sure that you've captured it. There are, speaking from a citation perspective here, we have guides and information out there with regards to how to do risk assessments. We've got some example risk assessments, but please get, those of you who are not citation clients, please get some support and assistance on that to make sure that you've actually got a process in place to recognise. I mean, the important element is, what are your processes? If some days they've got it, how are you going to deal with that? Do you have a simple process in place of checking frequently with individuals whether or not, it's all well and good on the first day back at work, have you got any issues? But I think it's again a matter of making sure that there's a continuation of that as people continue with the new normal as to whatever that is going to be. So it's making sure that people have an understanding of what they need to tell you about, and more importantly, what you need to be asking, so that I just suggest that people have a process of identifying should there be any live COVID-19 issues. I think that with regards to organisations who travel out and visit other sites, whether they be under your control or under somebody else's direct control, it may be that you need to put in place there a simple process for verifying before you do that task or job that they're not going to endanger your staff as well. So it almost becomes the reverse of that, so that you are posing as effectively as the contractor providing to somebody else. Is it safe for my team to enter this building and do what I, as a safety practitioner, would call a dynamic risk assessment, so that when your guys are out, they say, are there any issues in here that I need to be aware of? Very similar to how, in the construction industry, people ask, is there any asbestos I should be aware of? I think that this needs to become the new norm, where people are saying, are there any issues in here with regards to people suffering with COVID-19? Now, there are some obvious organisations that currently spring to mind, and that's obviously the hospital and medical facilities. If you're supplying staff to those areas, obviously you don't want, where possible, for those guys to be exposed to live COVID-19 cultures and so on and so forth. But we're seeing more and more in the care industry, especially in the care homes, that there are issues in care homes with regards to service users who are suffering with COVID-19. So again, it's a matter of being able to sensibly manage that risk, because if you've expected to go into an area to service a piece of equipment and so on and so forth, then you do need the relevant PPE and potentially RPE, respiratory protective equipment, to make sure that you can work safely in those areas. So again, it comes back down to sensible risk management and precautions in place to make sure that people are doing what they need to do. Do I have to change my products? Truthfully, I think it's always useful to review products that you use for cleaning and for sanitation and so forth. There's loads of innovation going off out there in the world, but you don't have to. Not from a safety practitioner's point of view. You should always be continually reviewing what your safe working practices are and making sure that others are doing what you've asked them to do. So it's a matter of making sure that individuals are keeping up to date with things. I mean, again, this comes back to your risk assessments. If you're regularly reviewing your risk and cost assessments, you should be saying, is there a means of us actually avoiding doing this activity? And if there is, avoidance is always the best methods, but there are going to be some tasks that you cannot physically avoid doing, and you need to make sure that whatever you're doing is reviewing those working practices in place at that time. I mean, one of the areas that a lot of people are asking us about is with regards to, should I change my PPE? PPE, personal protective equipment. Again, this comes back down to the user and the task that you're undertaking. I mean, that there are some fairly obvious examples that provide the kit that's right for the individual. It's no good saying, as those of you who have not got a widescreen can see, I'm a fairly bulky unit. No good giving me something that says medium to wear when that is obviously not going to fit. So all I'd suggest is that obviously make sure that whatever you're providing is suitable for the individual is intended for. So I'd just make sure that people think about things and just say, right, I can't get that for that individual, so do I remove them from that task? And that may be the case. It may be the issue is that you don't have the suitable equipment for them to use, therefore until you have it, then they're effectively excluded from undertaking that task. But there could be other things into consideration, that I think that we need to start becoming more aware of. That may be people with breathing difficulties and so on and so forth. So whereas previously individuals with asthma weren't seen as being massively high risk, under the current guidance with regards to COVID-19, asthma, diabetes and heart ailments are definitely seen as being at risk, or more at risk, with regards to COVID-19. So, all I'd say to you is that you need to consider what your options are and making sure that people are doing what you want them to do, and more importantly, making sure that they're following some sort of set procedure for it. I mean, one of the areas, I don't think we're in that phase at this moment, but when people are considering reorganisation of a building or an organisational structure, is to consider what you need, and obviously then build things around that to make sure that there's suitable systems in place to recognise actually we don't have the same number of people as we used to have, and what's the protocols, making sure that if we have an emergency, what are the responses to that. It may be that there are other things that people need to consider with regards to first aid in the workplace and so on and so forth. So it's not as simple as just saying, oh yeah, we'll do a COVID-19 risk assessment. You need to be regularly recognising different pieces of this jigsaw will move around as people move into and out of physical tasks that they're doing. I'm just checking through my notes. I seem to be struggling here. There's not a huge amount coming up on the right hand side of my screen for some reason, so I can't see any other questions that's coming through. But I've got a couple of cleaning routines. Do I need to review? Yes, I would, as I mentioned earlier, with regards to your cleaning routines, that I think that this is a whole new area where people need to be a lot more. I use the phrase clinical with a small c, that they need to recognise that in order to limit the opportunity for COVID-19 in particular, but other things in the workplace to spread, that health and hygiene, I mean, definitely that one of the things that I'm seeing with regards to, I know there's not everybody's interest, but in the construction industry, you are seeing big changes in practices of how people are coming to sites and so on and so forth. The booking in, booking out. One thing to be aware of as well is with regards to your office environment. If you've got a manager's office that typically people come into and sit down and have a chat, are they going to maintain that 6 foot distance? Are they going to still socially distance in those offices? If not, you need to change the arrangements so that it's not, typically coming into the boss's office and it's a desk here and whoever's going to come in is sat next to them. Those are the sorts of innocuous things that people are going to need to recognise and change to go, do you know what, I didn't think of that before. Meeting rooms, again, where people are having meeting rooms and so on and so forth, with regards to making sure that not everybody's crowded into a meeting room. So again, it could be using video conferencing, it could be doing other things with regards to making sure that we have pickups on how people regularly interact with people. You may have I've just heard something come up. Dawn, my company goes to many all over the country to collect, shred and archive. What is the best, politest and quickest way to check these customers are offering a safe environment for our team centre? To be truthful with you, I'd contact them and say, right, we are conscious that we now need to change working practices. So can you please advise us what your working practices are so that we can adhere to them? And obviously, if they make sense, then that makes obvious sense for people to go back into and say, right, here's what I can see that you're doing, and here's what my team are going to do. It may be in some of those circumstances, depends on whether or not you're travelling to a vehicle, you may need to put other PPE in place if it's a single person going in and collecting. I would strongly urge that it's cleanliness of the surface. So again, one use gloves, gloves on, manoeuvre something around, put it back, gloves off, and disposed of. So it may be as simple as that, just a change in working practice that you may not have had in place previously. Single use gloves. But again, I'd ask the organisations that you're going to, what are the special precautions that you expect of us, and vice versa. Jez Hawkins, how do you see hair salons returning to work under the rules currently? Very good question, Jez. Unfortunately, at this moment in time, I think that the hairdressing, I mean, you can see that, I've not got a huge amount of hair in the first place, but the truth of the matter is, I think that the hairdressing industry is one of those that it is very, very close contact. It is extremely personal, and people are, very, very much, touching and cutting hair, washing scalps, and so on and so forth. I don't at this minute see how organisations are going to overcome that until we have far more to do with the vaccination in place. Who knows? There may be something come up. We've seen all sorts of information coming out here, but my concern is that it's how people are going to be able to demonstrate that they've kept to the social distancing wherever possible. I mean, on the flip side of that, hairdressers are typically very, very clean environments. Individuals are permanently washing their hands using barrier creams and so on and so forth. I think it's going to be because of the dexterous nature of cutting hair and so on and so forth. You don't want to be wearing gloves of any description. But the truth of the matter is, I genuinely don't know at this time, Jez. I mean, it's something that, we do have a number of clients in that sphere. So we are actively seeking information so that we can actually help organisations to address it. But at this moment in time, I'm not seeing an obvious solution. So I know that may not be the answer you wanted, Jez, but I'm not seeing the obvious solution. Question here from Rachel. Do you have any suggestions for schools, academies for the 2 metre rule? There's lots of guidance coming out currently from the Public Health England and from the Department of Education. There's lots of information and recommendations and suggestions. The truth of the matter is that you're going to have virtually no control over the students gathering and breaking the 2 metre rule, because it's what children do. It's part of the reason and rationale behind schools having been closed and nurseries having been closed in the first place, to try and minimise that. I think it's a matter of making sure that the hygiene practices in place are increased. I'm not saying that there weren't already really good hygiene practices in place there, but I think it's a matter of protecting the individuals. I mean, there's not enough research out there at the moment to say that the children are definitely not seeing the same repercussions, although there's been some worrying evidence recently of something new appearing for children. But the truth of the matter is that the 2 metre rule, I think, is going to be very, very difficult to implement, because just the natural interaction and the stimulation that children need, in schools, nurseries, academies, that there is an automatic need to be very, very close. So truthfully, I can't give you an honest answer at this minute in time to say this is how I see it happening, but there's lots of good information coming out from, as I say, the government are producing, the education department are producing information. I think it's going to be one of those that their teachers and those in those environments are definitely key workers. So it's a matter of saying, like, what's the process that we can sensibly introduce, and whether a headmaster, headmistress, or academy head is able to put those into place and be successful with them. So just scrolling down. Right, getting towards, conscious of the time, ladies and gents. Let's note here from Paul. Suggestion where 2 people have to get close, please. In our case, lifting and fitting vehicle parts. Okay, there are steps that you can put in place, and what, using the vehicle part analogy, if you're lifting a front grille into a vehicle where it's a 2-man job, or possibly even more, putting an engine part in that you need to drop down and to lock into a gearbox and so on and so forth. This comes back down to when you're doing those tasks, what are the precautions that you need to put in place? And those almost certainly are going to come down to some form of barrier with regards to breathing out, so that, you know, a suitable face mask. My guidance would be that if you followed all of the COVID-19 steps, that you're doing everything you can to keep people out of the workplace who have COVID-19. It's the ones that are asymptomatic, that aren't exhibiting the signs, that you've then got to protect anybody else from. So it's a matter of having a temporary work solution that you try and do those jobs so that everybody's in the same PPE or RPE, you know, the face masks and so on and so forth, at the same time, so that they do a number of those tasks, rather than having to go through the process of kitting up, doing that job, then de-kit. Obviously, with regards to some of the face masks and so on and so forth, it should be new kit that people are wearing all the time. So I would suggest that try and bunch those jobs up, or group those tasks together, so that you're actually doing a number of them at the same time. That may help an organisation certainly manage its there is going to be expenditure, additional expenditure to what you normally have, but it's again a matter of having a look at the process. Are there other mechanical aids that can be used to help secure and lift, you know, whether that be a hoist, obviously making sure it's been thoroughly examined and so on and so forth, but in place so that people can then use the piece of kit, and so it would actually free up one of the people so that they're not in that situation. It's difficult, Paul, because there are going to be elements in the construction industry, you see it all the time, where people are lifting heavy window lintels into place, that they've got to be in that same position. You will have it, as I said earlier, in engineering, where people could be manipulating a piece of sheet steel or whatever. It needs to be two people doing it. So it's how you actually address that task, and make sure that the individuals are protected at that time, and then wherever possible do those as periods, bursts of activity, so you do all of that task together and then move on to another area and do something slightly different. I mean, I think as this progresses, we will see more and more good practices come into place. You know, I, as a safety practitioner, see lots and lots of organisations now producing their own little mini videos and little guidance tips. So there's lots of good stuff out there. There's also some stuff that you do need to take with a sensible proportion of salt. But the truth of the matter is, look for some of your more reputable organisations that are producing things, and they will certainly help you be able to address and identify some of the sensible items that people want to do. Well, I don't know where that time has gone, ladies and gentlemen. I mean, you've heard me wittering on now for just over an hour. So all that remains for me to say is that hopefully some of this has been useful for some people. I do apologise that, you know, it wasn't scrolling up as the way it should be on the screen, but hopefully I had sufficient questions, and my colleagues were firing stuff through to me to say, all right, here's a question, and there's a question. You've been listening to Pete Doyle from the Health and Safety Department at Citation, and our web address is www.citation.co.uk, and this is available to everybody on the /Facebook on our website. If there are any questions that you want further guidance and assistance on, please don't hesitate to ring us, and our phone number is 0161 333 1652. I repeat, so our website is www.citation.co.uk /Facebook, and this session will be there for everybody to see in the future. And our phone number is 0161 333 1652. And just a quick reminder for everybody, I'm on the health and safety side. My colleague Makatia is delivering a presentation for everybody, similar time next week, next Wednesday, I believe, with regards to employment law and HR. So, you know, the two do sit closely related to each other. So please don't hesitate to drop in on Jill's presentation next week. And all I'd say to everybody is please stay safe out there. Hopefully, if there are any nuggets of information that you've heard from me today that you're able to just put into place in your workplace, anything we can do and organisations can do to make the workplace safer is only beneficial to everybody in the long run. So thank you very much, everybody, for your time and patience today, and don't hesitate to contact Citation should you need any further information. So thank you all very much, and stay safe. Bye bye all.